Okay, nitric oxide, previously known as endothelium-derived relaxation factor. Nitric oxide has emerged as a molecule which is integral to many physiological and pathological processes. It's from LRG9 and oxygen by nitric oxide synthesis. An indivisible form of NOS has been shown to be present in macrophage. So nitric oxide has a very short life, being inactivated by oxygen-free radicals. So what is the effect of nitric oxide? Basically, it does is vasodilation and inhibits platelet aggregation. So it doesn't let platelet aggregate and also cause vasodilation. So the effects on acts on guanylate cyclase, leading to raised intercellular CGMP levels and therefore decreasing calcium level. Vasodilation, mainly venodilation, and inhibits platelet aggregation. So yeah, decreasing calcium level also causes the vasodilation. Clinical relevance: underproduction of nitric oxide is implicated in hypertrophic pyloric stenosis. Lack of nitric oxide is thought to promote atherosclerosis. In sepsis, increased level of nitric oxide contribute to the septic shock. This is why septic shock occurs in the first place, because of high levels of nitric oxide. Organic nitrates is widely used to treat cardiovascular disease like angina, heart failure. Sildenafil is thought to potentiate the action of nitric oxide on penile smooth muscle, and is used in the treatment of erectile dysfunction. So this is how also it acts on erectile dysfunction, potentiate the action of nitric oxide on the penile smooth muscle. Okay, ANP is a powerful vasodilator and a protein hormone secreted by the heart muscle cell. It's involved in the homeostatic control of body water, sodium, potassium, and fat. ANP acts to decrease the water, sodium, and adipose loads in the circulatory system, thereby decreasing blood pressure. So it kind of decreases the water, sodium, and adipose load on the circulatory system. That's how it decreases the blood pressure. So basics is like secreted mainly from myocytes of right atrium, ventricle in response to increased blood volume, and secreted by both left and right atria, right more than left. 28 amino acid peptide hormone which acts by CGMP and degraded by endopeptidase. Actions is basically natriuretic, promotes excretion of sodium and lowers BP, and antagonizes action of angiotensin 2. So all these help to lower BP. B-type natriuretic peptide (BNP). It's another hormone produced mainly in the left ventricular myocardium in response to strain. While heart failure is the most obvious cause of raised BNP levels, and any cause of left ventricular dysfunction such as MI or valvular disease may raise the levels as well. So raised levels may also be seen in right heart strain, in pulmonary embolism, and constrictive pericarditis, or even decreased excretion in patients with chronic kidney disease. So CKD patients may also have high BNP. Factors which decrease BNP levels include treatment with ACE inhibitor. So what's the action of BNP? Actions are vasodilator, diuretic, natriuretic, suppresses both sympathetic tone and RAAS system. The clinical use of PNP is diagnosing patient with acute dyspnea. Low concentration of PNP, less than 100, makes the diagnosis of heart failure unlikely, but raised levels should prompt further diagnosis investigation to confirm the diagnosis. NICE currently recommends BNP as a helpful test to rule out a diagnosis of heart failure. Prognosis in patients with chronic heart failure. Initial evidence suggests BNP is an extremely useful marker of prognosis for chronic heart failure. And guiding treatment in patients with chronic heart failure. Effective treatment lowers BNP level. Screening for cardiac dysfunction not currently recommended for population screening. So it's not really for screening, but it's helpful in heart failure patients. Okay, next is endothelin. Endothelin is a potent, long-acting vasoconstrictor and bronchoconstrictor as well. It's secreted initially as a prohormone by the vascular endothelium, and later converted to ET1 by the action of endothelin converting enzyme. It acts via interaction with the G protein linked to phospholipase C, leading to calcium release. Endothelin is important in the pathogenesis of many diseases, including primary pulmonary hypertension. So endothelin antagonists are used in treatment, so that's how it's important. Um, so endothelin is a vasoconstrictor, so antagonists are like used to dilate. Cardiac failure, hepatorenal syndrome, and Raynaud's. So all these may have use of endothelin receptors. So endothelin promotes release what angiotensin 2 ADH, inhibits release nitric oxide prostacyclin. So inhibition will cause dilation, vasodilation. Raised levels in primary pulmonary hypertension, hypoxia, mechanical shearing forces, MI, heart failure, ARF, asthma. Interferons are cytokines released by the body in response to viral infections. Important. And neoplasia. So they are classified according to the cellular origin and the type of receptor they bind to. Interferon alpha and beta bind to type 1 receptor, while interferon gamma binds to type 2 receptor. Alpha and beta, 1 type 1, gamma type 2. Different alpha produced by leukocytes, alpha L leukocytes. Antiviral action, as said before, insulin hepatitis B and C, Kaposi sarcoma, metastatic renal cell carcinoma, and hair cell leukemia. Adverse effect includes flu-like symptoms and depression. And interferon beta, produced by fibroblast B, antiviral action, the frequency of exacerbation in patients with relapsing remitting MS. Interferon gamma, produced by T lymphocytes and natural killer cells. Weaker antiviral actions and more of a role in immunomodulation, particularly macrophage activation, may be useful in chronic granulomatous and osteopetrosis. Weaker antiviral action and interferon beta is decreases the frequency of exacerbation in MS produced by fibroblast, and alpha is the one which is more like looks more significant here, more use. Okay. Tumor necrosis factor. Uh, it's a pro-inflammatory cytokine with multiple roles in the immune system. So TNF, secreted by macrophage. So like a macrophage will secrete TNF, and has several effects on the immune system, acting in a paracrine fashion. It activates macrophage and neutrophils. It acts as a co-stimulator of T cell activation. Key mediator of body's response to gram-negative septicemia, TNF. Similar properties to IL-1, anti-tumor effect, phospholipase activation. So TNF alpha binds to P55, P75 receptor. This receptor can induce apoptosis, and it also causes activation of NFKB. We'll come to that soon. So endothelial effects include increasing expression of selectins and production of platelet activating factor, IL-1, and prostaglandin. TNF promotes fibroblast proliferation and the production of protease and collagenase. So what's happening here? It's thought fragments of receptor act as binding points in serum. Systemic effects include fever, increased acute phase protein, and disordered metabolism leading to cachexia. So these things can also happen. TNF is important in pathogenesis of rheumatoid arthritis. Okay. So TNF blockers, some of them need to know. So it's basically a cytokine produced by macrophage. Okay. It has there's a lot of roles, and there are some blockers as well, like infliximab